By supporting carers and by supporting family members, it brings down the stress. They don't feel like they're fighting alone. Being able to step in and be like, oh, look here, a few simple things and a few simple tweaks, making those tweaks to optimise people's comfort.
Hello and welcome to HSE Talking Health and Wellbeing. Today we're delighted to welcome Dr. Rory Nee, Consultant Physician in Geriatric Medicine, and Aoife Quinn, Clinical Nurse Manager with the Integrated Care Programme for Older People. And they're both based in St. James's Hospital, Cherry Orchard and Harold's Cross. So you're very welcome, Rory and Aoife, and thank you very much for joining us today.
Thanks very much.
Thank you. We're delighted to be here.
Absolutely.
Great. So today we're going to talk about how older people can keep well over winter and give them some tips about that. But first of all, from speaking to you and in preparation for this interview, you've mentioned that you've both worked for the Integrated Care Service for Older People. And it just sounds like an amazing service. So I don't know, Rory, do you want to start us off? And we'll talk about that for a little while and then we'll get into the whole advice for older people.
Great, yeah. The Integrated Care Programme for Older People, or ICPOP, as we'll call it from now on. It's otherwise a bit of a mouthful. It's a national programme and it's part of Sláinte Care. And it's a wonderful scaffolding of care for older people to deliver on that Sláinte Care goal of the right person getting the right treatment in the right place at the right time. And Aoife and I and our team, that place is the person's home. We're really lucky because we're aligned to St. James's, and St. James's has the Mercer's Institute of Successful Ageing on campus, which is Ireland's only Institute of Successful Ageing. So from the very start in St. James's, we had a lot of services for older people already. So when we got the Sláinte Care funding for ICPOP in 2020, we were really able to sit down with older person services, primary care, MEDEL, which is Medicine for the Elderly in St. James's, and St. James's Hospital Management to figure out how exactly we could use this multidisciplinary team to keep people in their own homes. There's 3 different streams that we do. So one of them is crisis case management. So our aim is to intervene really quickly with rapidly putting in care, healthcare assistance, specialist nursing, OT, physio, to stop a crisis ED attendance and a hospital admission as a result of a crisis of care.
So this is before somebody gets to the hospital at all?
That's right.
So a GP would refer somebody on, is it?
Absolutely.
Okay, fantastic.
And that's the idea, that we step in, and because otherwise that person might end up in the emergency department because of a crisis. And if we can get in early, we can prevent that hospital admission. And then the other ways is we look at early supported discharge. So for older people in the hospital that need rehab. So traditionally they'd have their inpatient rehab, but we step in, get them out much, much earlier than the other would be, and then do that rehab in their own homes. So they're learning how to walk back up their own stairs in their own bathrooms. Like they like going to mass, they like going to the shops, to get the bus. Our OTs and physios and nurses go in and we help that older person regain their independence after a hip fracture, for example, or injurious falls. And then the third thing that we do, we look after older people living with and dying from the advanced stages of dementia. And it's a service we offer with a community advanced nurse practitioner and the community palliative care team. So the 3 of us as a team, we look after that person at home and support their families and carers to let them continue to live and die at home if that's what their wishes are. So those are the 3 main streams that we offer in the community, as well as the nursing home outreach service as well from the
Rory,
hospital.
that's amazing, really. And Rory mentioned at the beginning there, Aoife, that people in crisis, when you say crisis, what would that mean? What are the typical cases that come to you?
No, absolutely. And we have so many. So the crisis cases would be, and they could be brought to the GP's attention. So that's why the GP would do either a home visit or patient would go in. And it could be even down to just a hoarding issue, an alcohol issue, but it also could be down to, they're not collecting their medication, the pharmacy would get on. So everyone is linked in. So the pharmacy might get on to the GP and say, Mrs. Jones hasn't collected her tablets in 3 months. And that might be the one thing that'll highlight what's going on. And that's when the referral might come to us. And we would go out there and there could be a huge amount of problems then. But medications would be the one thing. Or we would have neighbours who might say, I've seen Mrs. Jones out in the road in the, early hours of the morning, or I haven't seen her. I'd see her every morning opening her blind, coming out, having a chat. I haven't seen her. So, neighbours are great. They get concerned. They'll go to the GP. And that's when we would go out and do our full assessment. And things that are brought to the attention of the GP, they will put on that referral. And when we go out, there could be an awful lot more we pick up on, because we do a full holistic assessment.
If they don't know you and the GP has referred them on, it's not a self-referral. So they might come to the door and say, what are you doing here?
No, absolutely. And we'd always ring first, but we'd also always like for the GP to have met the patient, definitely. Yeah. It's not always the case, but the GP would have a good picture of the person and would know, and they'd ring us and have a chat about the patient. We'd also have contact people. So maybe their contact person, their niece, their nephew, their daughter.
Yes.
And we would always contact. We'd never just land on the door,
Yeah,
I think,
yeah.
and especially for an older person, for safety and everything. And it's over the phone. You'd get a little bit of an assessment and they might say, no, I don't want anyone. No, that's, I suppose, the beauty of the team. We can coax, and once we get out there and meet them, then we can really get them involved with the care that they need.
They will plan the care, and once you get to know them, you'll know the type of care, what services they
Absolutely.
need to be put in.
And it's patient-centred, so we're not going to push anything on anyone, but all we can recommend is what they might need that might make life a little bit easier. Once it's in place, then they kind of go, yeah, it is easier, because they've been doing things for so long their way, just maybe not that safe.
Yeah.
But definitely neighbours are great. Neighbours are great for even ringing the GP saying, Mrs. Jones is not around. I haven't seen her, or she's knocking on doors late at night or early hours, things like that, know, or the Meals on Wheels haven't been brought in, they're at the door. So there's all those kind of things.
Okay. And Rory, I think it's really interesting what you said about keeping people at home for as long as possible, especially if they've got dementia or something like that, and you work with the palliative care team as well. I have friends of mine who try to keep their family members at home for as long as possible, and they do everything, like you said, they go over and above. But sometimes it does just get to the stage where maybe a nursing home is the option, but you have the facilities to keep them at home even longer then.
Well, absolutely. Well, by supporting carers and by supporting family members, it brings down the stress. They don't feel like they're fighting alone.
Yeah.
And sometimes they're like, God, am I even doing the right thing? And sometimes people with more advanced dementia get very agitated and bothered. And then sure, everyone's upset, and then being able to step in and be like, oh, look here, a few simple things and a few simple tweaks, and sometimes settle that agitation, and that support can often prolong the carers being able to look after them, and knowing they're doing the right thing and having the availability of the teams coming in and making those tweaks to optimize people's comfort. I think as well, one of the things from the crisis point of view is we step in really quickly. So straight away, we're starting on a good foot, aren't we, Aoife?
Yeah.
So our average response time is about 3 days from when we get the referral. The GP might say to the patient or the family, look, I'll call the integrated care team. Unfortunately, I think waiting lists are something that we all kind of know that there might be. So when the next day or the day after we've got Aoife,
they get a shock.
That's amazing. That is an amazing turnaround
It's great.
time.
Yeah, no, it's fabulous to be able to do it. Yeah, absolutely.
And do the referrals always come from the GP? Obviously, you said discharge as well, so they must be hospital referrals.
So we take referrals from the GP, but also then from other hospital consultants, from the community palliative care team, from psych of old age. We do take referrals from a lot of different medical professionals.
And how long does this service last for, Aoife?
We'd say in around 6 weeks.
Okay.
But you know what? We can get an awful lot done in that time, and we might be able to discharge earlier because we feel we've put everything we can in. They're safe now and they're happy and all the supports are in. And a lot of the time it goes well over. We're never going to discharge unless we're happy. And that's why we have our MDT and we all discuss the patient. And if we're not happy to discharge, we won't. Yeah.
So this is just introduced in 2020. So obviously it's a growing service. And Rory, is this just in St. James's or is it all over the country?
No, it's a national programme. So I think there's 22 teams nationally across the whole country, and all in different stages of recruitment and kind of planning and depending on what their particular area needs. Like one of the key fundamental parts of it is kind of mapping out what's needed in your area and then coming together to provide that. It's 6 weeks. So I suppose you should really look at it as hospital admission and it's ED admission avoidance, So it's a community virtual ward is how we look at it. And I suppose if you think of it that way, as somebody's in a crisis, to get a call, I have a look, chat to the GP, maybe on the frailty hotline, send Aoife or one of the specialist nurses, one of the OTs out really, really quickly. And then we admit them under our care in the ward. So you can kind of see it as this is an alternative to being sat in a medical ward in St. James's, where it's so busy and you're out of place and you might fall or get confused. So we admit them to the ward and then we rapidly put in our own carers. And one of the really, really good ways that we can do it is, Aoife was saying sometimes an older person might be like, I don't want to care and I'd never. But the current model of home care packages is that they're so busy and they've so many people to see and they have to come in and say, all right now, Johnny, we're going to wash you now and I've only half an hour and then I have to race on to the next person, and they don't have that time. But we have that time in our 6 weeks. Our carers go in and Aoife will say to them, look, for the first week or two, you have a cup of tea with Mary. You have a cup of tea with Johnny and you get to know them and have a chat. And then maybe a week down the line, we say, will we do your hair? Will we do?
It's just building up a trust.
Building it up.
And trust is everything.
Absolutely.
And especially with older people who are maybe living in communities that are different now than they used to be. Or maybe some of their neighbours and friends have died.
Well, exactly.
And their families are living abroad.
Exactly. And I was with a gentleman the other day who said the exact same thing. He's living in his flat complex for 20 years. And I was like, what are your neighbours like? And he said, they've either passed away or moved out, and it was just always, they would have had a great community up to a few years ago. And now he's not going out as much. our community connector on our team, he was a great dart player. So I was saying, well, we try and get back into it.
Fantastic.
So they're going to link in with him again. And it's lovely because he kind of felt, no, like I'm nearly 80. I don't need to be going out anymore. You know, there's so much life in him.
Absolutely.
You know?
And you know, I always think with older people, sometimes people see them as just older people. They never ask them, what did you do? What did you work at?
They have a history.
What do you enjoy?
Yeah.
And they've got so much experience and so much
and it's lovely to hear the stories.
Yeah.
And you would sit there all day sometimes with some people. Getting they love to talk.
That is patient-centred care,
exactly.
isn't it?
Exactly.
That's what it's all about. So that's a really good understanding of the whole ICPOP, Rory and Aoife. And I think that nobody is better placed than to talk about winter wellness for older people. Because if you're going into people's houses all of the time, you can see the risks that are involved. You can see what they need to do to get ready for winter. So if you were to think about it, Rory, what would be the main things and the main steps that people could start with? And today, I suppose we're talking to older people, but we're also talking to their families and to their neighbours, anybody who helps an older person. And the weather's not too bad at the moment. So we're thinking, let's think ahead a little bit.
There's an awful lot of things that you can do to keep yourself well. And I suppose this just doesn't apply to older people, to everyone, you know, and
That's
like
true.
The same good advice to younger people is for older people. So vaccines, I suppose, coming into winter, like every year we see it, so many people getting the flu, really sick with it. So many people getting COVID, really sick with them. So get your vaccines, get them early. That's one of the key things. And then just overall health and well-being then is exercise. So God, it looks like you have to exercise until the day you die. Unfortunately, I was devastated when you found that out. But it keeps the muscle mass, it keeps the muscle memory. You know, a lot of times as well for older people, it's wonderful what you can do is combined classes. So you get your exercise and your social connectivity in there. So exploring with your public health nurse and your GP what various different exercise classes that are around specifically targeted at older people that are retired and at various different levels of ability, you know, and you can mix your exercise with your social connectivity, and that's a great way. I suppose falls, just being aware as well of falls. So coming into winter, it's very important to kind of make sure you have enough hydration, you know. So we find a lot of older people who drink loads of tea, and a cup of tea never hurt nobody, but tea makes you pee, and you end up getting a little bit dehydrated with tea, you know. So often I'd say have a cup of tea in the morning or two and then change over to decaf if you love tea. Decaf tea actually tastes really nice. You wouldn't notice the difference. And make sure to keep your fluid intake up, because you need pressure, you need water in the tank and pressure to keep you up and walking, and we all do that. Medications, making sure you have your medications, and for carers as well, making sure that an older person is taking the medications in the right way. You know, pharmacists can do, there's a lot of blister packs we can do. Any of us could get a bit mixed up, you know, or Jesus, did I take my tablet this morning, or, you know, like, or not. So any of us could do that. So keeping an eye and making sure that you're good at taking your medications. I suppose over Christmas time as well, like some people will have a drink or two, you know, or a lot of us do, you know. But as you get a bit older, you know, if your day is kind of having loads of cups of tea and then a few more glasses of wine or beer, whatever you'd be having than you normally would, it's a much more increased risk of falls. You know, you're going to get more likely to be hydrated, be a little bit kind of funny on your feet, as any of us would after. So just to be mindful of that, to kind of be careful of not getting dehydrated and having too much over Christmas especially.
Yeah, exactly what you say there, Rory, because we've done a few podcasts on brain health and the importance of social connectivity and the difficulty around loneliness and stuff. Aoife, what type of things could people get involved with?
Absolutely. So when we would do our assessment, and that's, as I say, having that big conversation and the chat and getting to know someone, you get to know their past, what they liked, what they loved doing. And it's then trying to encourage them to say, well, look, I could find you a singing class or a bingo. Because, you know, when you mention day centre, people go, that's only for older people.
I know.
You know, and immediately they just go, no. But, you know, that's the beauty of our assessment. Then we go, oh, so you did play darts or you loved to sing, you know, and there's a lovely choir attached to James's. People have joined that, and it's an outlet because they're singing, but they're meeting people. They're forgetting about their issues and their loneliness.
And we've loads of evidence to show that singing helps your mental health.
Yeah, absolutely. Even if you can't.
Yeah. Well, exactly.
Maybe not the people around you doesn't help.
They're a little bit deaf. But no, absolutely. And you know, it is difficult. And that's why when we hear, yes, they're going to actually go once a week, it's just to try it.
Yeah.
It's not for everyone. It really isn't. And that's why we'd encourage family, look, maybe you might go with them for one or two of the session. And then after that, often they'll say, oh, they didn't want me to go with them, but they're fine.
And of course, we have our social prescribing as well, that the social prescriber could go with them.
Absolutely. Exactly. And she would do a thorough assessment. So she would really get down to the bottom of exactly what they would love to do. And it could be just something simple like starting off an allotment again. You know, that kind of thing that they would have loved doing, but they're like, no, I'm getting too old. I can't get down to it. So we try to organise even getting them down, getting a lift down, and that's where you'd get neighbours involved.
Yeah.
Because they might be going themselves and we'd say, well, could you bring Johnny with you?
I
Maybe,
know.
it's just connecting everyone.
And it's daunting. Like at any age, it's daunting starting something new or, saying, oh, well, now you go here, there, wherever to meet this group and that group. And like any of us would be a bit daunted by that. So like, it's lovely. Our healthcare assistants are a social connector. It's not just go here and here's the list. It's like, here, come on now, we'll go together and you'll see the gang. And
exactly.
And that intro, like it's really,
it's
really
very
key.
hard for anybody to walk into a room,
Absolutely.
and if you haven't done it for a while and you're a bit older and maybe your partner's died
Absolutely.
or whatever, like it is very difficult.
And
so that's amazing.
Even down
really.
to going to mass. Some people are like, I don't have the confidence to go. And our HCSAs will say, well, come on, I'll be with you for 10:15. We'll walk down to mass. And that has made their day.
I know.
And it's just something simple, but that's their thing. That's their belief. That's what they want to do and get back to doing it. And we often hear, I'd love to get back to going to the shops for the coffee or going around the corner to get my hair done. So that's where our team can.
And it's to try and keep that up over winter when I know, the weather is bad and stuff like that, but try and keep that social connection,
Mm-hmm.
The other thing is when you mention medication, one of the tips that I've heard, Rory, is to kind of have your list of medication, have it available in case of emergency. Yeah. On the unfortunate time that you do have to go into hospital or something, you bring it with you. So people know what medication you're taking, and check it with make sure, like you said, keep it up to date and have maybe next week's or next month's available in case the weather is bad with your pharmacy and stuff like that. You can get medication delivered now and stuff.
You can,
can't you?
absolutely, absolutely. It's good too to have that conversation about your medication because some people they're like, I don't know why I'm on it. I've been on it for years.
Yeah.
And that's another thing. So a lot of people are on their medications for years, So we look after people in their 80s and 90s and in their 100s. And, blood pressure tablets often get started when someone's in their 50s, and then they're never changed. And then the person gets to 90 and it's brilliant. Those blood pressure tablets have done their job. That person hasn't had a stroke or heart attack and they're 90. And now that medication might be a bit strong for them. So for our patients and for carers as well, if they're on a rake of tablets and then the 3 or 4 of them could be blood pressure tablets. If that person is noticing, oh, Jesus, I'm a little bit woozy when I get up or go to walk around or a little bit dizzy, it's a sign that, maybe the tablets are too much now or maybe we should relook at that. So if somebody is getting that and they're on a rake of tablets, it's a good idea maybe to go in to the GP and have a chat and say, look, should we look at the blood pressure a little closer? Or, is it a time to kind of review the tablets? A lot of GPs will straight away get in and make the changes, but they can refer on then to older persons' clinics or ICPOP or, anything. So it's a good idea as well for the tablets to think, to
talk to family as well, because sometimes they'd say, oh no, I'm not going to give them that tablet now today, and they might decide themselves. So we would have that conversation with them as well, that they're on them for a reason. They might say, no, I'm not giving that today, and that can be
cause
serious
problems.
Yeah.
So really for people even coming up to winter and stuff, I mean, people in your service, obviously, then that's been looked at automatically. Whereas other people, like you said, Rory, go to your GP, get it checked out. And so this is advice, not just at this time of year, at any time of year, really, to keep an eye on it. But in the winter then, what are the kind of common illnesses that people would need to watch out for, Rory?
Look, it's flu season and it's the respiratory. We get a massive increase in respiratory problems, and then, sometimes like little minor illnesses like a flu or anything can tip off somebody if they've got heart failure or something. It can make the heart failure worse. Often like minor illnesses, if somebody has some memory issues or they might have a milder dementia, they can get a little bit more mixed up or confused or delirious. It's a real sign then to go early to get help, before things get a little bit worse. Talk to the GP, it's emergency, obviously, into the hospital. Unfortunately, these respiratory illnesses and viruses and stuff, they can trigger other things like strokes and things like that. So all that advice, the fast advice of your face, arm, timely access, if you think that there's a stroke, all of that, get yourself in. And then for other more minor things, see your GP earlier, get those changes, get the antibiotic in as when an oral antibiotic will work for the person versus waiting a few days and then they're in bits and need to be in ED on IV fluids and IV and everything, So
it's back to the thing is prevention is better than cure. And if you're not feeling well, maybe stay at home, mind yourself for a few days. But if you do need help, get help, obviously. But maybe even if you have grandkids, if they've got colds or coughs or whatever, maybe just keep
or
it,
bugs, you know, even vomiting bugs, just to stay away for a while. Yeah,
because that can really set everything off,
And just as well for family members that are caring for older people that are frail or very, very frail, and they could be very independent and managing really well, And if you or I get sick or the flu, we'd end up on the couch giving out for a few days, but still able to get to the toilet and get your food and all the things. But for older people that are very, very frail, they might have gone from managing really well, and even a minor illness, then they might need an awful lot more help. They might need help then for their food and the basic things that they usually can manage. So just to be aware that if your older mum or dad or grandmother, grandfather is a little bit sick, they might need more minding than a person that has the man flu,
absolutely.
you know.
Yeah, and Aoife, you know, we've mentioned falls, and that is a very difficult thing. And then if you hear older people, you know, breaking their hip or whatever, and that's always so traumatic for people. And then there's no avoidance. They have to go into hospital. Yeah. But how could we prevent that? And there must be fall prevention that we can do.
Oh, absolutely. And like when we're in a house, we only walk through the door and we can probably pick 5 things that would definitely make someone fall. And again, you're talking about change and trying to say to someone, listen, you wouldn't mind just the mats. And we demonstrate how they'd slip. And then I'm not taking up those mats, but it's just about, you know, saying what the risks are, even down to the bedclothes. You know, we'd say to the family, when you're doing the bed, can you make sure that they're not, people do get up to use the bathroom in the night. And that's where we see an awful lot falls. Their foot gets caught in the sheet hanging down and down they are on the floor.
That's a simple one that you'd never think about.
Yeah,
really.
Absolutely. And clutter. I mean, we all love a bit of clutter, but it's just, it could be stuff everywhere. We do have extreme cases. And you know what? We look at them and go, I don't know how they haven't fallen before this. And again, it's to be respectful because it's their house. It's how they live. But again, we just want them to be safe, you know. And that's when we kind of talk to family. And we might just say, look, just whip up that mat. Yeah. Just little things like that. If they slip easily. And we would encourage then the pendant alarm because of those things, which is a little alarm on your hand if they were to fall.
Just explain a little bit about the pendant alarm. Yeah. Can anybody get that?
Anybody can get it over 65.
It's perfect for
Absolutely.
People to have.
It looks like a little watch or you can get the necklace.
Right.
So many people have it. It's a safety measure. And once it's explained. Now, obviously, people with a cognitive issue, we may have difficulty in remembering to press it. But someone who would have a fall, they've pressed it. They've got help almost straight away.
So where does the help go to?
So you would put 2 contact people. So you might put your daughter or your neighbour. So if it's the person presses it, it goes straight to the company. So it's task for us. And they would say, Miss Jones, are you okay? And there's a little box. And they'd be able to say, no, I'm on the floor. Or they can say, I've pressed it by accident. They're okay. Those incidents are fine. And they'll go, right, I'm going to ring Deirdre. She's on your list, you know, and Deirdre will come if they can get her.
And this 24-hour service?
Absolutely. And it has saved people. And if Deirdre can't answer for some reason and the second person does, they'll get emergency service.
Anybody over 65 can get that?
Absolutely.
And again, is that through the GP?
No, anybody can actually ring the number and apply for it. Absolutely. Okay. But that's what we would do as part of our assessment. And again, it's encouraging someone, you know, because my gentleman the other day was like, absolutely no way, and he had a fall. So I'm working on him because I think that's really one of the only things he probably needs.
And what is it that stops people?
Oh, do you know,
it's for those things?
Wearing this, it shows people there's something wrong. And then you might say, where's your pendant alarm? Oh, it's upstairs in a drawer.
Yeah.
You know.
It's like, where's your hearing aid?
Totally. Exactly. Or your glasses. Thing. It's all that. So it's just encouraging people. It's also saying to them, like, it doesn't mean that you're really old that you have to wear this. It's just, if you fell, you can get help straight away.
So for anybody, that is a perfect thing.
I would encourage everyone of an older age, definitely.
I know what you mean, though. It is kind of just a shame. Like people saying, oh, for God's sake, I can't believe I need that kind of thing. You know?
And my man the other day was on the floor for hours. And I said, you know, Jerry, you could have rang that.
Yeah.
And instead he was in his hall shouting. And thank God someone went by the door and had to kick the door in. Yeah.
Yeah. But that's just a really good example of how the pendant could work.
Absolutely. Yeah.
So do we know where people can access that?
So we have the numbers and it's through task. So we have a number that we ring and we give the details and we give the contact person. Yeah. And then they ring the person and the contact person. So it's really good. Yeah.
Yeah.
And along with the pendant alarms as well, part of Sláinte Care is, so every area should have an assistant technology memory OT, and they're attached to a memory technology resource room. All over the country, there's a lot of them. And these OTs are specialists in older person's tech. And that's older person's tech that the older person themselves can get involved with. So that there might be tech that they want to do and kind of more enabled technology that can help, you know, like bigger buttons on phones, different types of trackers for, you know, a tracker in your purse or in your coat or on your keys, you know, for things getting lost. So there's an awful lot of tech that's available that can help older people and help the carers and the people caring for them. So there's other sensors you can get for it, like fall sensors and different type of things, depending on a person's need. And that assistant technology memory OT and the memory technology resource rooms, that the public health nurses, your local public health nurses would know the contact details and to book an appointment and just to go in and see, well, what exactly is there? Like that's
fantastic.
And to help enable older people. The pendant alarms and stuff are subsidised to an extent, and there's an awful lot of sensors that can be attached to the same pendant alarm hub. I think a lot of the technology has to be privately sourced, I think. Isn't that right, Aoife?
Yeah.
You know? the memory technology and the advice from the OT is free.
That's it.
Yes,
They get
yes.
the advice.
They can do the assessment
and
for
they can
free.
source them, like even on Amazon, they can get the same type of thing, like the likes of the Ring doorbells. They're all really good as well.
Yeah.
To help that person help themselves, and then to help the carers help them. There's automated kind of pill dispensers that will have an alarm at a certain time, have an alarm, and then the pills pop out. And there's a whole load of tech for a whole load of different areas in the home.
The orientation clocks.
The Ring doorbells, they're brilliant. You know who's coming,
you know who's at the door. Exactly. It's just to try and instill the safety back to people, because people are very trusting, but they're also very vulnerable.
Yeah. And all of these
assistive technology memory OT.
Okay.
They're funded all over the country. It's part of Sláinte Care and part of Living Well with Cognitive Impairment and Dementia.
Okay.
So they're all over the country. And just about falls as well, other things you can do to prevent. So if there's any visual problems or cataracts, like getting that repaired is really helpful. If you're worried about the home, so the decluttering is really important, like Aoife talked about, but also rails can be really important. So, rails in the bathroom, in the shower, second rails in the stairs, and medication reviews. So having a look at making sure the medications aren't too, the blood pressure tablets aren't too low, or there's too many sedating medications. So there's a load of tweaks you can do to prevent falls. And then the pendant alarm and the fall sensors and those various things are to minimize the harm when a fall does happen, or to minimize the harm. So there's preventative things you can do, and then harm minimization things you can do when a fall does happen. And then always think about bones and bone health, like, do you have osteoporosis? If an older person's fallen and they've got brittle bones or osteoporosis, then, there's such good treatments for osteoporosis now, such good treatments that aren't arduous for a person, like an injection under the skin every 6 months or an IV drip every year, and it strengthens up the bones. So you're trying to minimize the harm and the risk of that person breaking their hip or having a fracture,
Yeah. And then diet, I suppose, is another one as well over the winter. Maybe have a few non-perishables that if you can't go out on a day, that if the footpath is slippy or something like that, or have people that you can call, neighbours that you can call over the winter, so that they maybe, if they're going to the shop, they can get the fresh loaf for you.
Absolutely.
That kind of thing,
And we would talk to people at Meals on Wheels. They're great. That's a hot meal with a dessert every day, and they'll leave an extra one for the weekend on the Friday. That kind of thing is great.
And it's another person calling to the door.
Exactly. That's another welfare. Exactly. The shops are great. They're all doing ready meals, and they've really improved. So they're nice. And some of them will go, oh no, I don't like the little ones, but I prefer the spar ones, and they'll play around with them, A lot of people, like some of the pubs, do delivery meals. And again, that's engaging again. And it's lovely to see a neighbour calling in going, I'm going over to the shops, have you milk? Because when we do our assessment, we're like the nosy neighbour. We would, with permission, open the fridge. And we could open the fridge. There could be nothing in the fridge.
I know.
There could be very little in the cupboard, nothing's fresh, that kind of thing. And it's just about saying who's getting the shopping, and they will say, oh, I'll be going later, and we'd offer to go and do a bit. But we'd find out the support's there of who that person is, because they'll often say it just to be saying something to us, oh, I'll be going later on. But you want to see the fridge with a few bits in it.
Yeah.
The butter, the milk, the fresh bread.
And if somebody does have a difficulty with their brain health as well, obviously they kind of forget, and
Completely.
they need a little bit of reminder.
And they could be
then
eating
they get
gone off food.
And it's kind of just getting into a routine to
Absolutely.
get these things into the house.
Definitely.
Rory, the other thing is these days people keeping warm in the winter as well, and being afraid to put the heat on. And then the dangers around putting the fire if they do have an open fire. And that's a risk for older people at home as well.
Absolutely. Gas fires, gas cookers, massive risks, and for people who smoke, to make sure that the cigarettes are being extinguished safely, that can be a risk. So again, being sensible, and if somebody's falling a lot in the open fires, you're dead right, Noreen. But it's so important to keep warm. So again, public health nurse, the kind of social workers, if there's difficulties, there's a lot of different grants available to kind of help improve homes, and OTs and social workers can help engage with older people and their families on how they can kind of improve and upgrade their homes to keep them warm and safe for them.
Yeah, I think that's really important. No more than not wanting to wear the pendant. It's like an admission that you need help. But I think people and healthcare workers now really know how to negotiate with the person. So they're there to help you. They're not there to catch you out or to show you up because you can't afford.
And sometimes they don't know the allowances they're entitled to. They just don't know. Yeah, and some of them are really good.
Yeah. So that's it for family members as well. If they feel that somebody is entitled to an allowance, then maybe to go and just check it out and get it and be ready and have that fuel there for the person, that they're not afraid to put the heat on. The awful thought of an older person sitting at home with like 5 coats on and afraid to put the heat on. It's just not fair.
And somebody see that is older. So much. Yeah,
you see it so much.
Absolutely.
Houses.
Yeah, turning off the heat, don't need the heat, and they'd be layering up
Oh, yeah. So look, it's just to encourage family members or whatever to help people with that.
The other thing as well about eating, social eating is really important. So
Okay.
we all enjoy meals more when you eat with
Yeah.
friends and you eat with family and everything. So social eating is really important. And that's one of the nice things about the day centres. They do lunches, and a lot of the social activities and for family members, like if you are dropping in food to your mum or your dad or your grandparent or whatever, have a little snack with them as well, and have that chat. It just makes it that little bit nicer for everyone,
Absolutely. And again, the social connection, keeping the brain going, having the chats.
Yeah.
Doesn't matter what it's about, but it's just stop for those extra few minutes.
And everyone will say, I'm so busy. I did drop in a cooked chicken and, but we'd say, look, just give 20 minutes, sit down, make the sandwich with them, let them make the sandwich for you. Makes all that engaging.
Yeah. Oh, it makes so much difference to people, doesn't it really, And
the home care packages are great now as well, like that you can get carers that can come in and they can help the person and, so that's great as well.
Yeah. So the other thing that I was looking at with this as well is when you look for the information for people, is like to know your air code. If there is an emergency or you do have to call 999, that you know your air code, that you have it written there beside the phone. So look, we're coming to the end of the podcast now, Aoife. And what would be your main pieces of advice to give people coming into the winter?
So advice really is to definitely engage with family, to even the patient themselves, by the phone or not even on their mobile, but have a list on the fridge or beside the phone of their contact person, but even emergency services number, because, you could have someone on the floor. They could have been on the floor for a while. They could be a little bit delirious. They can't think of numbers. So just to put the contact person, emergency services, it's really important to link in with family. And most families are great. They're really supportive, but we see an awful lot of people who are on their own. So we would talk to them about, when you're coming into the winter, do you have everything set up? Who collects your tablets? And it's just to be aware of all their kind of activities of daily living. Are they all covered? Are they all minded? And sometimes they're brilliant, but sometimes they're not. And sometimes they do need just little tweaking that we'd say, no, you know what, we'll get on to the chemist and have your tablets delivered. Or we would, again, encouraging the Meals on Wheels. But it definitely, those numbers, because if we're in a house, we need to be able to contact people. And sometimes they can't think. They're panicking. They can't think of phone numbers. And some older people are not great with mobiles. That's the kind of advice we would give.
Yeah. And I suppose you're talking for all healthcare workers then, if somebody did have to call the emergency services, that everybody will need access to these and to include their air code as well. So
Absolutely.
that they can just call out their air code if they need it in an emergency situation, if they did need emergency help.
And sometimes we would, if access is difficult to a house, we would encourage a key box.
Yes.
A lot of people are against it, but if you go up and down the street, so many houses have them now and they have a code and they are very, very safe. They don't have to be hugely on view. They can be down below, but it's just, then someone has the code to get the key to get in to help someone,
Yeah. And Rory, just back to you now. Is there any other advice that you'd just like to give?
Just to give advice in general about memory problems and issues and dementia, there's nearly 65,000 people in Ireland living now with dementia. Just to give some advice to people and their family and their carers, if you notice that you're getting forgetful or that your mum or dad or your grandparent is getting forgetful, there's so much we can do for people to help them live well with dementia. And I know loads of people that are happy out living at home. They have memory problems, but you tackle them and there's so much can be done. There's educational courses, OT courses, cognitive rehab, there's medications, there's tweakings. There's so many little tweaks that you can do, ensuring that to maintain your memory and to keep your mood and to live well with it, and it is possible. And that's what we really want is for people to live well with dementia as well as they can, do everything you can to prevent it and keep yourself safe. But if there are memory issues there, it's not a normal part of aging. The sooner you seek help from your GP, or the sooner you seek help, the sooner you can get interventions and strategies that can help you, can help everyone around you, and that you can help yourself to maintain yourself. I think that's really important.
And not to be ashamed of it, not to be afraid to look for support and assistance and we have the Understand Together campaign in the HSE as well, and all the communities that are involved in that. And there's multi-agencies involved in that. So there's help out there for people.
On our ICPOP team as well, one of our OTs, we're running memory courses and jog your memory courses. And they're so good because they're group courses as well. You might feel like you're the only one, or you might know anybody, or you might remember your own grandmother from the 50s or the 60s or the 70s who had dementia and her journey might have been awful. That's not the way it is anymore. There's so much you can do. And you can see people coming into the courses and then they're meeting people and they're like, oh, shit, Jesus, you're forgetting your key. You're forgetting that. And oh, God knows. And that camaraderie. And then also you can engage with strategies to kind of help. And all of these things are so important for easing somebody's and improving somebody's journey with dementia,
Yeah. Well, look, thank you very much for joining us on our HSE Talking Health and Wellbeing podcast. I'd like to give a special thanks to Rory and Aoife for sharing your expertise and practical advice really on how people can stay well over winter. And really, it was general advice on how to stay safe in their own home and stay in their own home for as long as possible. And like you said, Rory, Sláinte care, giving the right care to the right people at the right time. And that is just so important. And that's what's going to maintain people in their own houses in years to come. So we hope today's discussion has given you useful tips and encouragement as we head into the winter season. Remember taking small steps like staying active, getting your vaccinations, checking in with friends or family, and keeping up with your health checks can make a big difference to everybody's wellness. Please share it with others who might benefit. Take good care, stay connected, and know that there are people out there to support your health journey. So thank you very much for joining HSE Health and Wellbeing.
Thank you.
Thanks, Rory.